I am Dr. Subranshu Sengupta. I am a senior consultant in cataract and refractive surgery at Center for Sight, Kolkata, AJC Bose Road Branch. So before undertaking any refractive surgical procedure, there are a few things that we need to check. Ideally, the age of the patient should be more than 18 to 21 years, but basically what we most importantly look at is the stability in the refractive error. In other words, the refractive error, the power of the glasses should be stable for more than 6 months at least. Secondly, we of course look at the condition of the other structures of the eye. For example, sometimes young people might develop cataract due to various reasons. In these patients, of course, we do not go ahead with the refractive surgery. Once the complete eye examination is complete, then we go ahead and do a test wherein we study the curvature and thickness of the cornea. Now, if the thickness is adequate, then we can go ahead for the cornea-based procedures. But if the thickness of the cornea is not adequate enough, or if the curvature suggests otherwise, then of course we go in for the intraocular procedures like the phakic intraocular lenses. The other very important aspect that we have to look at is whether there are dry eyes or not. We run a variety of tests, and in case dry eye is detected, then definitely there are various methods. We put eye drops, we wait for some time for the eye to stabilize, for the wetness of the eyes to increase, and then we go ahead for the refractive procedure. And of course, the other very important thing is that whether the patient is on any particular drugs for any systemic medications or not, then the same should be informed to the consultant so that he or she can take an informed decision and discuss about the same with the patient. As far as the post-operative care for refractive surgical procedures are concerned, primarily if it is a cornea-based procedure like LASIK, then you would have to put eye drops and you would be back to your work within the next 2 to 3 days. Of course, you might have a little bit of grittiness of the eyes, and they usually are well controlled with the use of topical lubricating eye drops. For a smile patient, of course, the grittiness is much lesser because we are disturbing a relatively smaller part of the corneal surface. Hence, the recovery is faster. For an intraocular refractive surgical procedure, ideally, we would want you to stay indoors for the first 7 days and put the topical eye drops. After 7 days, you would be able to get back to your work. However, activities like swimming are best avoided for the next 6 weeks or so.
Follow Center for Sight and post your queries to get answers from the experts.